All right. So about Dr. Shuvo himself is a brilliant student, and he joined, and he didn't participate. Okay, in our course classes. So I was thinking, like, why this person is not attending any class, any mocks? What happened? So I called him and I asked, "Is there any problem?" And he was saying, "No, I'm having so much pressure of the work. That's why I cannot join." But I think from May, he was pretty regular about the course and all that stuff. So, Dr. Shuvo,
Yes, sir.
congratulations for passing this
Thank you, sir.
exam. I'm so
Thank you, sir.
happy. Okay, and trust me, I knew this that you are going to pass. Okay, and
Thank you,
once
sir.
I called you today and you were silent, okay, after, like,
So,
picked up the phone, I was like thinking,
so
what
actually,
happened?
at the time, I was
Okay.
sleeping.
Yes.
Suddenly, I woke up and saw my result, and I was totally shocked that
Hmm.
uh, because I was expecting result will be published on Friday as per assumption. So I was not prepared for the result. So I was literally saying this: is it my role or I'm passed or failed? So after that,
Correct.
is this my role and I have
Correct.
passed the exam. So I
Very
was
nice.
so much happy for that.
Okay. Now let's share the entire journey, Dr.
Uh,
Shuvo. The floor is yours.
uh, Thank you, sir. First of all, uh, I'm so much grateful to my Almighty Allah for the passing exam. And next, I'm very much grateful to Dr. Atik sir. And I will not say much more thing about Dr. Atik sir because what I say that will be very less for him. Just I want to say just these things because he's a very good mentor because from my side, sir, as per sir said, I admitted in February. I couldn't join the class. Actually, that time I had a very huge workload, and I couldn't join the class. But I watched the recorded video each and every day. Then sir called me, and I told him everything about my working environment and everything. And then from the May, I totally became regular in the class. But uh, but one thing, uh, when I joined in the IMG group, before that I bought some books for the part B, but I read them, but that seems quite difficult for me, especially anatomy part or ASCC part. uh, After that, I attended the class of one of the ethics, especially the anatomy. And trust me, that was the main game-changing class of one of my life. I never seen this kind of class from any teacher or any mentor. I can remember I saw what's the first class of the upper limb, and I became literally fan of his teaching method. Actually, I didn't have to memorize anything. Just I try to memorize the images only. But one thing is main. I want to say when I became regular on the May session, uh, that time I feel like what I have read, I almost forgot everything as I didn't attended any mock. Then I try to participate in the mock every day, and gradually I am feeling that I can remember something. I Then one thing is the key to success from that after as Pixar is doing very good with his teaching method. But one thing is I think from my side, key to success is the repetition. That means revise, revise, and revise. You have to revise the books as much as you can. It is possible. From my side, I think you have to revise the book minimum 5 to 6 times. Otherwise, knowledge portion you cannot uh, answer the knowledge portion, because knowledge portion is like anatomy. There are new images, but this is easily identifiable. So I think this is not very tough. And and what they ask about the anatomy stations, everything on the book. I think everything at least 80 to 90% from the book. On critical care station, everything from the book. There is no new question in my stations. There is no new question. I have answered them within 6 minutes, and I was just sitting there silently for 3 minutes in critical care. In pathology stations, I have uh, found some new questions, like as Dr. Vivek said, from the basic pathology, like um, what is the definition, actually definition of granulation tissue, what is the healing processes, then what is the function of the fibroblast, what is the function of myofibroblast, like this basic thing. This is this some are new questions, as this is exam, so you have to face some new questions. Don't bother about new questions. New questions are very few, like 20%. If you answer the other 80%, you can easily pass the exam from my side. And skill part is very important skill. You have to repeat it like um, as much you can possible, like 7 to 10 times or 8 times, and you have to watch the video every day. Sorry, you have to watch them or practice them every day. uh, and clinical examination, communication, then history taking, you have to discuss it regularly. Like I have discussed with Dr. Vivek from a history taking examination. He was very brilliant on history taking communication. Also, this is very much helpful. And also, what I did when Dr. Atik sir taking class of the knowledge portion, I was revising them at the same time the skill portion. When Dr. Atik sir uh, was taking class of the skill portion, I was revised the uh, and knowledge portions, as the every part is very much volatile. If you don't revise them frequently, you will forget them easily. That is why I try to read them regularly as much as possible. And after that, I attended most importantly the hands-on course. That was the one of the best and game-changing hands-on course. I think from my side, this is one of the best game-changing for me, because um, for that 4 days, Dr. Atik sir taught us everything about this skill portion. At that point, when I finished the hands-on course, I just finished. If I sit the exam right now, I will easily pass the skill portion. I have that much confidence at that time. So that was very beneficial for me. And most importantly, main thing is the last month of the exam, and you have to revise the entire syllabus on about 3 to 4 times. And the last 7 days are also very much important. You have to finish the entire syllabus at least once, and you have to make your own notes and your own strategy. And I think if you feel quite clumsy, you can easily apply the Dr. Atik sir's 10-step approach. This is very much helpful, and you can easily pass the exam with this 10-step approach. But this is the everything, and don't go for the different notes. Like there are lots of notes in the market. Only stick to the IMG notes, and only stick to the Dr. Atik sir's uh, class and what he said in the class, just try to follow. I think you will easily answer the question within every question within 6 to 7 minutes, or you can easily answer the 80% question directly from the Dr. Atik sir sports, and Baki another 20% question you can answer with a residual knowledge, or you can uh, answer them easily. But this is the portion of how I take it, I took preparation of the exam. But main thing what I felt main problem in the exam, in the I went to as I'm from Bangladesh, I went to Kolkata. So I firstly felt problem about the food, about the residence, and about the everything. So other than that, those who are going to sit for exam in the another country, please try to maintain everything.
I
Don't
disagree. I disagree with you, Dr. Jaman bhai. The foods in
like
Kolkata is very nice.
oh, okay, very
It's so
nice.
tasty.
Yeah, very nice, but I'm not familiar with that food. Like they because there is food habit little bit different
Yeah.
in our house or like that. So I was literally I became sick at that moment in Kolkata.
Hmm.
So,
Hmm.
so that was my I was really scared of that. And main thing when I main thing about the strategy of the exam, this is a very important thing. I from my side, basically I think uh, your preparation is a 50%, your strategy is 50%. If you prepare well but you cannot deliver, there is no value of your preparation. I think you have to deliver it very decently. I think from my side, what I did when you enter the examination room, or like any station, please take permission from the examiner. Then please try to talk to him with a very smiling face. As like you are just very comfortable with him. Like don't be casual, but be formal and try to smile, talk to him with smiling face. Then give your sticker and ask permission for the sitting, and after sitting, please thank him. And trust me, I said in every station. And from my side, they what I answered wrong, uh, 2 or 3 questions answered wrong, they again asked me, did you want to answer them again? I said, yes, sir, I want to answer them again. And they took my every answer in every knowledge portion. I was very grateful to the examiner, because from my side, I think I was very much sober at that moment. That is why they are asking me that question again and again. And in skill portion, you have one thing, you have to maintain 10-step approach, plus you have to be very much gentle, formal, and very much sober with your smiling face. This is the key to performance, because first impression is very good, very much impactful on your exam, as it is an OSCE exam and you have to face in entire exam. So I think yeah, strategy is the main thing in the passing in this exam. Other uh, as knowledge is or preparation is 50%, your strategy is another 50%. And most importantly, uh, those who are giving exam uh, in December or January, please don't be afraid if your 1 or 2 stations or was good or bad or mediocre. Please don't be upset, because once the bad station or 2 bad station cannot make you fail. So please don't be afraid. And what happened in the station, please leave them in the station. Don't carry that things in the further stations. If you carry them in the further stations, cannot answer, and surely you will fail them. whatever your preparation is, because there, as this is the new this is the examination, there must be new questions, obviously. If you cannot answer them, so don't be frustrated. What is new for you, that is new for most of the candidates, because all of the notes in the market are same, almost same. So you have to keep your nerves so that you can answer the further stations. I think this is the thing what I followed in my examination.
All right, Dr. Shuvo. Very nice to hear from all of you, and very nice. Thank you so much, and good luck for your future. Anyone wants
Thank
to
you,
ask
sir.
anything from Dr. Jaman Shuvo? Okay. All right. So thank you, brother. See you soon. Okay.
Thank you, sir.
All
Inshallah.
right.
Thank you,
Thank you
sir.
so much. Thank you.